Today we will be discussing alarm fatigue in critical care nurses. My name is Ashley Haney and I'm from Montevideo, Minnesota.
My name is Sophia Agbashin, and I'm from Cheyenne, Wyoming.
I'm Izzy Van Veldhuizen, and I'm from Sioux Falls, South Dakota.
I'm Mallory Looserock, and I'm from Slayton, Minnesota.
So we decided to look at different alarm sounds or measures that would decrease alarm fatigue in critical care nurses. Hospitals can get very chaotic, and with all the different alarm sounds, it is important to know what ones are priority and where nurses can improve in this aspect. There's a high occurrence of alarm fatigue, which can lead to different adverse events and relate to decreased patient safety in response to the alarms. That being said, our PICO question was, does alarm management education decrease the occurrence of alarm fatigue in critical care nurses? We then found research that was reliable and strong evidence, and a lot of research suggesting implementation of education on alarm management and its positive effects.
So using the databases, the CINAHL database, the PubMed database, EBSCO, and Google Scholar, we found evidence to support our PICO question, and we restricted articles to research that was done within the last 5 years and research that is peer-reviewed. So we have found 5 really good articles. One is a level 1 article, and there are 3 level 2 articles and a level 3 article. And one of our articles showed that nurses need more education regarding alarm fatigue and how to manage it. 2 of our articles investigated the effects of changing different alarm parameters and the effect that this has on alarm fatigue. These articles showed that changing the parameters on the alarms decreased the number of alarms and decreased alarm fatigue in nurses. So overall, our evidence showed that educating nurses regarding what alarm fatigue is and how to prevent it decreased the perceived level of alarm fatigue in critical care nurses.
So for the results portion, throughout our project, they showed that there is a deficit of knowledge about alarm fatigue and that there is a need for education in the future. Training by adjusting alarms included adjusting parameters for heart rate, non-invasive blood pressure, respiratory rate, oxygen saturation, and number of pre-ventricular contractions per minute. When people received education, there is a decrease in the number of alarms, decreased alarm duration, and decreased levels of alarm fatigue in critical care nurses. For the recommendation portion, we recommend implementing continuing education programs in regards to alarm fatigue and alarm management among critical care nurses by adjusting the parameters.
So next, our group kind of discussed the different ways to evaluate the different variables of our research. So first of all, measuring the number of alarms that sound, we suggest using the data collection on the alarm software. And then also measuring how long those alarms last. You can also use the alarm software data collection as well. And then when talking about nurses' perceptions of alarm fatigue, we suggest doing things like nursing surveys, just kind of asking questions about what they think about alarm fatigue throughout their shift. Next, we talked about the feasibility of our recommendations. And since we're not necessarily recommending changing software or getting new software or anything like that, we're just recommending more education. We think that's pretty feasible. We think it would be both time efficient and pretty low cost if we educate like the charge nurses, the unit managers first, and then they can take their education back to their units and then kind of apply it and make it relevant to their specific unit and then educate their floor nurses from there. And then we talked about the implications this has for clinical nursing practice. And like we discussed, we believe that more education would decrease the perception of alarm fatigues in critical care nurses. And this kind of opens up the door for further research in regards to how that affects things like patient safety, the quality of care patients receive, and then nursing well being as well.
So the project impacts a quadruple aim by better outcomes, which leads to less adverse patient effects, improved clinical experience, which leads to decreased alarm fatigue and more perceived control, lower cost, which leads to better patient outcomes, and also training the manager. So the manager would be trained first, and then the manager would go and train their nurses so that they're not training so many all at once, and improved patient experiences. So if there's a quieter environment, patients will be able to get more rest so that they can get better faster, and the alarms will get answered in a more timely manner. This concludes our presentation. Thank you for listening.